So in cases, medication related issues are coming in different forms. One is mistake scenarios in which the medicines are given wrongly to the patient. Then the second scenarios are coming like missed doses of medicine of patient. Then the scenarios are coming sometime overdose is given to the patient like insulin. Then another scenario is coming like drug interactions. Certain drugs we should not combine together. So this is another type of scenarios coming. And then the scenarios are coming with the side effect categories of the medicines. So one by one, I will give a few examples, then we will proceed from there. So mistake scenarios are coming like wrong medicine given to the patient. Like nowadays, one scenario is coming, the patient is admitted with multiple systemic sclerosis or multiple sclerosis. Patient is suspected case of multiple sclerosis, and the patient is for lumbar puncture for the diagnostic procedure, and clopidogrel has been given wrongly. It was for some other patient, but given to this patient wrongly. So it is mistake scenario. So we will follow the same mistake approach. We will be honest to the patient. We will inform the patient that the mistake has happened, and I apologize for this mistake, and we all are responsible, and we all are upset why it happened to you, and we have taken some important actions to overcome this problem. So this type of mistake should not happen again. So what actions you have taken, doctor? This medicine we already stopped. We will not give any other dose. Incident report has been written. Nursing in charge has been informed. Consultant has been informed, and we have involved the risk management committee. The case has been referred. The scenario, the situation has been referred to them. They will try to find out why this happened, and according to their findings and according to their recommendation, we will follow their advices and recommendation. So it should not happen again. Why it happened to me? Probably it happened because the name of you and the other patient who is on clopidogrel having the same name, Mr. William, Mr. William, or Miss Sarah, Miss Sarah. So what we will do now? We will check the patient now with three names, and we will check the patient identity with three names and double check with the medical record number also. So it should not happen again. So these are the possible solutions. So obviously patient will be angry. So we have to inform what happened and what actions has been taken, and we have to give reassurance that it will not happen again to you and to any other patient. The clopidogrel scenario. So now we cannot do the procedure at least 5 to 7 days because this clopidogrel increasing the chances of bleeding. So we should postpone this procedure. For this, I am very sorry again that this happened to you, and we will run some tests also to check your chances of bleeding. So we are managing, and we are finding out the cause, and we are just postponing your procedure to next 5 days to 7 days. This is one of the examples. Another mistake scenario is patient is known allergic to medicine, for example, penicillin allergy, and wrongly given to the patient, and the patient developed allergy. Okay. So in that scenario also, more or less same structure will be followed. In some scenarios, one scenario is coming like bronchial asthma patient, and the patient received the beta blocker, and the beta blocker is of some other patient. So this is another mistake scenario. Then the scenario are coming with the wrong dose is given. Patient for insulin, but the wrong dose is given. High dose is given. So patient developed hypoglycemia. So again, the same scenario, the same structure we will follow. We will be honest. Duty of control. When we are honest, it is known as duty of control. This illegal issue. Duty of control will be applicable. So we should be honest. We have to inform what happened and why it happened and what you are doing. So these are the 3 points that we have to focus. The structure will remain same, so I will not go into the detail. Then the second scenarios are missed doses of certain diseases. Okay, patient admitted with acute exacerbation of COPD, and the patient is known case of Parkinson's disease. The daughter or the son of the patient, they told the patient is on Parkinson's medicine. So just continue with these medicine with the treatment of acute exacerbation of COPD. But the doctor forget to write in the medication sheet, and the patient did not receive the anti-Parkinson's treatment. Because of this, patient become confused, or patient become numb, or patient become like listless. So they are blaming now. They are they are angry. So again, this is a mistake scenario. We have to apologize. We have to inform that mistake has happened, and we all are responsible. Why it happened? We are trying to find out the cause. Okay. Sometimes they are giving the scenario like missed dose and the patient died. So in that scenario, we have to say, yeah, mistake has happened. We are responsible for this, but missing 1 or 2 doses cannot lead to death. If patient is died, it will be due to some other reasons. So we will try to find out the cause. For example, this patient of Parkinson's, if died, so the 1 or 2 doses of anti-Parkinson's, if it is missed, patient should not die. Patient is died either because of severe pneumonia due to acute exacerbation of COPD. This could be the possible reason. Then again, if the patient died, then we have to think what is the possible cause of death. So sometimes postmortem examination is recommended. Okay. Then the third scenario is drug interaction scenarios. I will give some example. Like we should not give theophylline with clarithromycin. Okay. So it can lead to increased toxicity. Patient can develop fits. So in that condition, it is a mistake scenario. We should not combine azathioprine and allopurinol together. If it is combined, azathioprine toxicity can occur. We should not combine methotrexate with trimethoprim. Both are having the same mechanism of actions. So these are the drug interaction scenarios, some of the scenarios, examples. Then side effect scenarios of medicines. Patient was on warfarin, okay, and the warfarin is stopped due to hematuria or some other reason, and patient developed stroke. Okay, here we have to see what type of stroke patient is having. If it is hemorrhagic stroke, it is because of the side effects of the medicine, like the patient is having hematuria because of warfarin. So it is could be the side effect of the medicine. It is not a mistake. Warfarin was given according to the national and international guideline. Okay. But the warfarin is stopped because of hematuria and patient developed ischemic stroke. And then they are blaming because you stopped this and the patient was having atrial fibrillation. And if the patient is having ischemic stroke or thrombus has gone to the brain, then again it is very tricky scenario. Okay. So we have to see the warfarin was stopped by the consultant on strong grounds, then we have to defend. If it is stopped by the GP just because of some hematuria, then it will become the mistake scenario. So we have to read the scenario very carefully in such conditions. Patient on aspirin and patient developed side effects of aspirin. So this is another side effect scenario. So we have to see what side effects the patient is having. If the patient is known case of allergy to aspirin and the medicine given wrongly, then it will be the mistake scenario. But patient is not known case of aspirin allergy and the aspirin given in the best interest according to national and international guideline, and the patient develops side effects. So any patient can develop side effect with any medicine. So we just say sorry, we will not apologize, and we will say that we will stop this aspirin and we will give some alternate medicine. Okay. Then three terminologies of mistake we are facing. One is known as near miss, and the second is known as medical error, and the third one is known as negligence. So what is near miss? Near miss is something about to happen, some wrong thing about to happen, but it did not happen. Before happening, it is checked and it is stopped. So these are the preventable events that it was near to happen or near to occur. For example, the patient is known case of penicillin allergy, and it was mentioned that patient is penicillin allergy, and penicillin was about to be given, but somebody informed, somebody highlighted, some nurse told, no, no, this patient is penicillin allergic, we should not give. So this scenario is known as near miss scenario. Or the patient by himself, patient saw that the doctor or the nurse, they are prescribing or they are giving me the penicillin, and the patient raised the issue that why you are giving me penicillin. I mentioned already and written in my file that I am allergic to penicillin. So before giving the medicine, it was checked or corrected. So it is known as near miss. Then there is medical error. What is medical error? It is preventable events that happened. It was preventable, but it has happened. But harm not occurred to the patient. Okay. So what is medical error? Medical error is a mistake or this a mistake scenario that has happened, but the patient did not develop any side effects or the harm effect of that uh, incidents. Okay. For example, when patient is penicillin allergy, mentioned that the patient is having penicillin allergy and penicillin has been given by the mistake. But this time patient does not develop or did not develop any side effect or any allergy. So this is known as medical error. No harm occurred. Okay. The last one is negligence. Negligence is the mistake scenario in which mistake has happened, mistake has been done, and the harm has been occurred also. Okay. So this is known as negligence. Again, the penicillin, patient is allergic to the penicillin, penicillin given, and the patient developed the allergy also. Now this is negligence. Another scenario coming with the negligence like MRSA scenario. Patient developed bed sores in the hospital. The patient's position was not frequently changed. So it is negligence. So whenever there is negligence, we have to apply the actions. Apologize, stop the things, what actions has been taken, inform, and then risk management team will also dig out the cause and we will fix the cause. So these were the this was the important uh, explanation about the mistake scenarios. Thank you so much.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.